Hello, this is Rhode Island COVID update number 3, February 26th, 2021. As of yesterday, a total of 185,337 people have received their first dose of the vaccine in Rhode Island. 75,007 people have received their second dose of the vaccine in Rhode Island, meaning that those 75,000 are fully vaccinated. Now, if you look at all of Rhode Island, there are approximately 1 million people. And if you divide that by 75,000, it gives us about a 7.5% rate of people who are fully vaccinated. And there is still a long way to go. You remember, our goal is to hit 70 to 80% of people being fully vaccinated before Rhode Island can be considered out of COVID. You remember recently in my last videos, I talked about the Rhode Island Department of Health's strategy to vaccinate during phase 1. Most states vaccinated based only on age. They started with those over 75 and went to those over 65. There was nothing based on your job or based on your health. But Rhode Island chose to do different. In phase 1, we focused on healthcare workers in the hospital, first responders such as police, fire, and EMTs, frontline workers, people who work very closely with the public, and those 75 and above. That was the strategy. We are a little bit behind, but so far the results have been positive. The number of positive cases of COVID have gone down. The number of those in hospital beds has gone down, and the number of deaths from COVID has also gone down. I will show you the strategy is working. Here's a chart. You can see that the peak was in December and January. These numbers were very high, but in February, you will notice a significant reduction in numbers. So it is working. The Department of Health wants to tell the people in Rhode Island, thank you for your patience, your cooperation in allowing phase 1 to proceed before we move on to phase 2, 3, and 4. And they are asking that you continue to support this strategy. If you remember, I discussed how they had set up 2 state-run facilities for vaccination, not for testing, but for vaccination. There's one in Providence at the Dunkin' Donuts Center, and the second one is in Cranston on Socanoxet Cross Road. And those 2 opened last week, Thursday, and the number of vaccinations has risen significantly in that time. In the month of February, compared to the month of January, we have almost doubled the number of vaccinations given. So we are making progress and moving ahead, and that's very exciting. If you want to make an appointment, you do need to go to the website, www.vaccinateri.org. But if you need help with the website or making an appointment, you can call this phone number, 1-844-930-1779. Now, I warn you, it is an automated system, a lot of press 1, press 2, press 3. I did test it myself, and for a deaf person, it is not an easy process. There is no way for you to leave a number for someone to call you back. So I've already made suggestions to the Department of Health to make a few changes. When you call, it says press 1 for English, press 2 for Spanish, and then you're led through the process. I suggested they add a third option that you could push 3 if you're deaf or hard of hearing. And it would take you directly to get you out of that automated process and get you perhaps to the RIDO help desk where someone could help you make an appointment, or directly to some other group. So we are still in conversation about that, and I will let you know. But for now, you can use this number, 1-844-930-1779. If things change, I will let you know. The phone lines are open every day, Monday through Friday. They are open from 7:30 in the morning to 7 at night. On Saturday and Sunday, they are open from 8 in the morning to 4:30 in the afternoon. So they are open 7 days a week, which is very good. You may remember that we are following phase 1. And so people who are qualified should go ahead and make an appointment, and those who are not should wait. Unfortunately, some people who are unqualified and not eligible are going ahead and booking appointments. The computer system should kick you out based on your date of birth or whether you have health insurance or not. But sometimes it will let you through and you will get an appointment. And if you get there and you don't have the proper date of birth or the correct qualifications, they'll send you home. And if you do that, then you are actually blocking someone from getting the vaccine who is eligible at this time. So we ask that you please make an appointment for yourself when you're eligible and not cause delays.